Give it another minute or so just to allow more people to join, and then we'll make a start. Okay, we're past 11, so I'm going to make a start. So welcome everyone to this webinar where we're going to be talking about the migration to version 2 of the IAPT dataset and also the migration to the new submission service, SCDS Cloud. We'll be using this session to focus primarily on data quality. My name is Paul Arrowsmith and I'm the delivery manager for IAPT migration. And we also have Amol, who's one of our senior developers, and he's going to be helping me with part of the presentation. So just a bit of housekeeping before we get going. We're expecting a fairly large number of attendees, so to avoid any excessive background noise, we're going to mute everybody as they join the call. Similarly, with the large numbers, we may start struggling with bandwidth, so can I just ask that everybody disables their camera, please? And again, just to keep everybody on mute, if anybody has any comments or questions, if you can raise those through the chat facility, that'd be appreciated. And just to make you aware, we are recording the webinar so that we can make it available on our website for people who've been unable to attend. So in terms of structure, I'm going to spend the first 10 minutes or so giving you an overview of the delivery, how we've got to this point, and also calling out a couple of actions we need from you on the run up to go live. And apologies for those of you that attended the webinar a few days ago. This introduction will largely be the same as in the previous webinar. There's one or two new pieces of information, but generally it will be the same. So it's going to be a little bit of a recap for those of you that were on that last one. After the introduction, now I'll hand over to Amol, who will give us an overview of DQ reports and how to go about addressing DQ issues that you might come across in your submissions. And that should leave us with about 30 minutes to go through any questions you might have, which hopefully should be plenty of time. I should also point out that we have other people on the call, including Gavin Harrison from the Dataset Development Service. So between us, we should be able to answer any questions you have. So just looking at the timeline for this delivery first, and I'll point out the color code first. So everything in blue are items specific to the version 2 dataset and the submissions to SCDS Cloud. The yellow items are version 1.5 items and relate to BSP submissions. And then the items in grey are the work we've been doing preparing the SCDS Cloud platform ready for go live. So going back to autumn 2019, that's when the version 2 ISN was published. And the key activities that I've called out here in terms of preparing for SCDS Cloud are really about risk mitigation. Some of you may have been involved in the onboarding of mental health or maternity data sets to SCDS Cloud last year. And you'll be aware that there were some issues around those deliveries. So we tried to address those with the IAPT dataset. First, at the beginning of March, we migrated all active users from BSP. So at least that cohort of users didn't need to go through the manual registration process. And then we ran 2 phases of private beta, one at the end of March, and then again between the 13th of May and the 9th of June. Obviously, you're all aware that we were originally on a path to go live on the 1st of May. But because of the COVID situation, the decision was taken to extend BSP for a further 3 months. And it was this decision really that gave us the opportunity to run this second phase of private beta, which gave us some valuable learning, which I'll come on to later. And then looking at the timeline for data submissions, the BSP submissions have obviously been ongoing each month throughout this timeline, but the last BSP submission will open on the 4th of September for July refresh data and will close on the 25th of September. In parallel with that, we have the first submission window on SDCS Cloud opening on the 1st of September for August primary and closing on the same day as the BSP window on the 25th of September. And then finally, on the 1st of October, we're operating purely in an SDCS Cloud world with the submission window opening for August refresh and September primary. If you'd like to see other submission dates, these can be found on the IAPT pages on our website. What I should just point out, though, is that we've recently taken a decision in light of the DQ issues that we're going to come on and discuss. And to give submitters more time to resolve any DQ issues, this August refresh window will be extended by another month. So from the 1st of November, the standard windows of September refresh and October primary collections will still be taken, but it will still be possible to continue submitting August refresh for that month as well. So in all, you'll have 3 months covering August data. So just a few more words about registration then. This webinar, or at least a version of it, was first delivered on the 28th of February. Bit of a typo there, sorry, it was the 28th of February, not the 26th of February, but it was around about the end of February. And some of you may well have dialed into that call. And following on from that, we automatically migrated 98 active users from BSP onto SDCS Cloud. The thing is that the use of SDCS Cloud is dependent on two-factor authentication to verify the user's identity. So the message in that first webinar was really targeted at those 98 users to encourage them to log on to SDCS and complete their two-factor authentication setup so that any issues are resolved ahead of go live. And as of the 16th of April, going back in a little bit in time now, we were already in a fairly good place. 50% of those users had done that setup. With the 3-month extension and the flurry of activity around the private beta, we put this registration work on hold for a while, but we're now picking it up as we head towards the 1st of September. Since the migration in March, we've had 41 new users that have followed the manual registration process. And following the private beta, they've been added now to the SDCS Cloud user base. So now we have about 90 users that still need to complete their registration. So the action at the bottom there, in the penultimate bullet point, we have sorry, those 90 users. It's really imperative that those 90 users, if they haven't already done so, if you can please log on to SDCS Cloud and complete your two-factor authentication so that we avoid any registration issues during the go live. This is something that hit us really hard during the onboarding of the mental health and maternity data sets. So I can't stress enough the importance of completing this action. And just a word about the notes at the bottom. If you already use SDCS Cloud, say for mental health or maternity submissions, if you are also part of that migration of IAPT accounts from BSP, you just need to confirm which email address is associated with each account. So if you're using different email addresses for SDCS Cloud and BSP, then you'll still need to complete the two-factor authentication on your migrated account. If the addresses are the same, then you're good to go. The migration will have handled everything for you. So I'm now going to come on and give you an overview, give you a flavour of what happened in the IAPT private beta. Can I just ask that everybody goes on mute, please? As you can see, we had 19 sites involved, although in reality, this was 19 organisations. So some of the organisations had multiple sites. So in total, we had 35 sites involved in the private beta. There's a little bit of sensitivity here because I've put the sites in order of how successful they were in eliminating or reducing DQ errors. So I've anonymised the names of the sites involved. The main thing I want to get across here, looking in the second column, is the number of times the sites had to submit data. And I should point out that this was over the course of both phase 1 and phase 2 of the private beta. But there was a significant number of submissions that had to be made to get the level of success that we achieved in private beta. And that's the key learning from the private beta that we want sites to take forward into the go live. The final 3 columns show the statistics for their final and generally best submission. In terms of the color coding here, color code of green means that the final submission was completely successful. So the file was accepted into downstream processing and none of the records were actually rejected. All of the ones in amber had some level of record level rejections, but you can see in terms of the volume of the file and the number of records rejected, the volumes are very low. So it gives us a high degree of confidence that we're going to get good DQ out of these submissions. So the key findings from the private beta then. I think the first thing to understand is that the private beta was based purely on data from December 2019. The idea being to compare the publication measures from the private beta with those presented in the actual December publication from BSP. And on the whole, we found a pretty good match between the publication and the private beta measures, which gives us as I say, gives us that confidence that we're in a strong position for go live. As I said, it took a significant number of submissions, with the private beta sites working iteratively to eliminate DQ errors. The SDCS Cloud service provides DQ reports back to users, but they do have a different format from those provided by BSP. And we realized during these private betas that the sites were sometimes struggling to understand how to use these reports. So we've taken that learning and used it to produce a guidance document, which is now available on the SDCS Cloud pages on our website. And in a minute, Amal's going to focus on these DQ issues and provide an overview of the DQ guidance document. So the second action I want you to take from this is to recognize the issues experienced by the private beta sites. Take in what Amal says over the next few minutes, try and make time to review the DQ guidance document in more detail, and critically, please try and submit data as soon as possible after the 1st of September to give yourself enough time to work on your own DQ over the course of that first submission window. I will ask if anyone is going to have a particular problem in submitting data early, please put something in the chat facility so that we understand the issues you're experiencing at a local level, and we can perhaps look at ways to help you out. Okay, so that's it from me. I'm going to take a breather and hand over to Amal, who's going to cover the DQ section. Over to you, Amal.
Hello, good morning, everyone, and thank you for joining this webinar. Main objective of this webinar is to understand validation error types and how effectively we can identify those failed records and how easily and quickly we can correct them. So higher data quality will be achieved in each submission. So these slides and data quality has been prepared based on our experience of Pilot 1 and Pilot 2. So, yeah. So in principle, there are 4 main types of validations. First one is file level rejection, record level rejection, group level rejection, which is further can be subdivided into more than one group submitted, and no valid group submitted, and the last one are warnings. So first, most important one is file level rejection. So if file rejection or validation error that highlight a specific data quality, if this is triggered, whole file will be rejected. So we need to be careful when submitting data so that no validation error will be triggered of this type. So we just given a simple example. There are a few mandatory tables in IAPT dataset. One of them is header, and if header table is empty, system will trigger IDF reg 002 failed content check. Header table is empty, and the whole file will be rejected. There are few other file level rejections which you can identify and go through from TOS. There is a separate tab in TOS for file level rejection. Second level of rejection or record level rejection. So this type particularly are validation errors that highlight data issue in a specific column, and if which cause the whole record will be rejected. So bear in mind, like this will, even though it will process rest of the record, but it will significantly reduce, or it will reduce depending on how many record rejection of are present in the file. So this is a example of IDS 002 GP table. It's mainly pretty standard error where a local patient ID more than 20 characters and first record of this table will be rejected with record level rejection, which is IDS 00202, where local patient identifier has incorrect data format. This type of error is easy to identify from data quality. So LPI 000 up to 1 is a key. So you can easily identify and correct. And this is pretty standard across most of the record level rejection, where those key values are present in the key report to identify those records which are causing problem. Second one, and third one is group level rejections, and this is divided into two types: more than one group submitted and no valid group submitted. So first one, more than one group submitted. This is very easy to identify. Like people from SQL background, this is just a standard a primary key or a composite key type of validation. So we purposely try to put a composite key validation example from IDS 007 table. So if these two records are submitted in submission, then group level rejection will be triggered because there is a duplicate local patient identifier plus disability code combination. So it's a composite key duplicate record. There are other group level rejection where there is a single, it looks for a single column to identify duplicate record. But in this example, it looks for a combination of local patient ID and DSAP code, and the validation message shows you exact keys, which is LPI 001 and disability code 01. So this type of validation is also easy to identify from the key reports. The next one is no valid group transmitted example. So this can occur because of two reasons. So reason one, in this example we have given, where it could be triggered if records in child table are rejected, if there is no corresponding record present in the parent table. So we try to put a very simple example here which can explain the scenario. So so in LPI 001 MPI table, no LPI 001 record is submitted here. Only LPI 002 record is submitted. But in GP table, which is a child table of MPI, two records are present. First one is LPI 001 and LPI 002. So in this case, for the first record in GP table, there is no corresponding record from MPI table. And in this case, system will trigger IDS 002 to 0 group rejected as no valid 001 group transmitted for this local patient identifier. So this type of error is again easy to identify. So first, so we will go through in a short while after the next slide. The most confusing one is when records in child table are rejected if corresponding records from parent table are rejected due to a validation error. Significant difference between two previous example and this one. In this case, LPI 002 record is present in both tables, MPI as well as 002 GP table. And in previous scenario, LPI 002 wasn't submitted. But in this scenario, because its record is present, but EXBF indicator is invalid. And because because of that, MPI table record will get rejected with IDS 00159 validation error. And because MPI table record is getting rejected, there is no, so system will trigger that there is no corresponding MPI table record for GP table, and system will trigger IDS 00220 group rejected, no valid group transmitted for local patient identifier. And question is why we are doing this, because IDS 002 GP record is actually meaningless if without corresponding parent record, which is MPI table, and this will protect referential integrity of the system. So this is so there is to understand this scenario in more detail. This is SCDS Cloud page where we have a preferred document, SCDS Cloud Data Quality Guidance. When you click on that, it's more on this. I'm on page 11. It is a very useful document. We have put together a lot more detailed scenarios, and this is a pretty standard guide which is valid across all data sets for MHSDS, maternity, CSDS, as well as IAPT. And we identified top 10 validation errors in pilot 1 and pilot 2, both from IAPT and CSDS. And based on that, we have drafted this document to help all the sites to identify all the validation error. So when you see group level rejection, how effectively you can tackle it? First is you need to check, is my record present in the parent table, which can be done easily by filtering data quality report. So if there are any failures in parent table, then there is quite a good chance that this group level rejection is triggered because of parent table rejection. And to identify parent-child relation, on the next page, we have put parent and child table relationships for each data set. So this is the IAPT, and if you scroll down further, there's a community as well as mental health and maternity data sets there. So this table is representing parent-child relationship. This is color-coded. So for example, if there is a group level rejection in IDS 607 table, then you need to look for its parent, which is 202 care activity, and then you need to traverse through right across for 201, and 201's parent is referral, and so on. So this table will help you to easily and effectively identify parent-child relationship and to identify those failed records. So I would definitely recommend you to go through this data quality guide. I'll just quickly show you the index table, which is we are giving all the details of validation error types, what common issues, and resolving data quality errors. So this is very useful document. So once the last one is warnings. So warnings are where validation process identifies an issue and submit a file but does not reject any record. So warnings not rejecting any record, but it is actually issuing warning that there are still some data quality issues, and if you correct, then you will achieve further high data quality stats. So in this example, like 007 disability type table, where invalid DSAP code is submitted, and system will trigger this IDS 00707 warning. Disability code contains an invalid disability code. Again, it's defined with a key, which is LPI 1111 and disability code 11. So you can easily identify this type of errors. And that is all. We are open to any questions. Thank you.
Brilliant. Thanks very much, Amal. Okay, I'm going to start working through the questions that have come through the chat facility. So Gavin, I'll ask you to help out as well, because what tends to happen when I do this, I start answering things that have been answered further down. So if any questions, if any answers come through while I'm talking, please shout out, and then I'm not repeating things. Okay, I'm going to scroll back up to the first entry, which is 6 minutes past 11. So from Paul, can you do both primary and refresh in access file like we did BSP? This has come up in previous webinars, and the answer is no. Actually, that they're separate submissions. So as Saskia has put there in her response, that you do need to submit 2 separate IDBs, one for primary and one for refresh, as per MHSDS. The next one, I'm afraid I'm going to struggle with this, and I'm not sure anybody else on the call is going to be able to answer this. This is more an SDCS Cloud registration type problem. I'm not sure we've got the relevant people on the call. My understanding is that typically the 2-factor authentication is through your mobile phone, but there is a desktop application available as a separate option if you don't want to, or you can't, or you don't have a works phone, or whatever the problem might be with using a mobile. There is an alternative solution. And my understanding is that all of those issues that we experienced in the early days of SDCS Cloud have been resolved. But I'm not going to be able to answer this specific question on the Authy desktop app. Can I just ask people from NHS Digital or from anywhere else actually who's got experience of this, if you're able to offer any information on that over and above what I've said?
Yeah, I'm hi Paul. This is Amol here. There could be option of upgrading your Authy app. I was using the old version, and I reinstalled new version of Authy app and done the migration. So so you could look for that migration guide for Authy website.
Okay, thanks, Amal. I hope that helps. Obviously, if any further questions, fire them in the chat further down. So from Alison, for information, our system supplier Maiden is not enabling the version 2 submission until the 10th of September. Okay, that's the first time I've heard of that. I was aware of it, and we are aware of this with IAPT users. When we were on the 1st of May trajectory, they were planning to do the switch over on the 13th. And I was assuming it would be the 13th of September in this case as well, but obviously they've decided to go with the 10th now. So anybody who is an IAPT user, you probably had received this communication multiple times from Maiden anyway. But just please be aware that you need to get that you need to do your final BSP submission before the 10th of September, at which point your system will switch over and you'll be able to start submitting your first SDCS Cloud data. Okay, Prathna, please ask if 16 out of 19 pilot sites struggle to provide the submission, and if so, what were the main hurdles? Well, okay. I guess the high-level response to this is that the DQ guidance document, the main purpose of that document is really to articulate and provide guidance on the issues that the pilot sites experience. So I guess that would be the high-level answer. There were other things, and that is probably worth taking note of. One of the key things that hit us early on in the pilot is that the providers were struggling with their submissions because of lockdown, because people were working remotely. A lot of people were struggling with bandwidth, so they'd suffer a timeout. So then they had to find out some way of working remotely on a server to get the submission in rather than using local infrastructure. So we had a lot of problems like that. So I guess, will we still be in that place 1st of September? I guess a lot of you will be. So it's just worth bearing that in mind, that can be an issue. If you start seeing a timeout, typically it's because of a bandwidth problem with your local infrastructure. I don't know, there's probably all sorts we could add there, Amal. Is there anything else you wanted to add in terms of what were the main hurdles? You'd obviously call out the group level rejections that you've already talked about. Is there anything else that you'd specifically like to raise there?
No, I think we have main hurdle was to understand validation errors, and which we are covering now in our DQ guidance document. So that will really help everyone.
Okay. And question from Anna, we cannot make a test submission. The button is grey for RWX, not sure why. Okay, test submissions. So this is a functionality that has recently gone live on SDCS Cloud. It's currently only available, excuse me, for mental health and maternity. And that's because you need to have a submission window open for the test submission to work. So technically speaking, you're not going to see it for IAPT until the 1st of September. However, we are working with the SDCS Cloud team and trying to get to a position where we can open up a window before the 1st of September, which will allow you to make some test submissions early, and hopefully, and you will get DQ reports back as part of a test submission. So by allowing you to submit data, say in August, if we can get a window open in August, it would allow you to send those test submissions in and start testing your DQ issues that you might be experiencing locally. If we manage to resolve that with the SDCS Cloud team, then obviously we'll communicate that out separately and make everybody aware that that is now available. But as things stand, it won't be there until the 1st of September. So Anna, where will we be able to find this recording? So on the recording, it's probably going to take us a few days because we need to make sure it's satisfying accessibility rules. We've got to do some work on the transcripts once the recording is finished. But hopefully by the end of this week, we'll make that available. We think at the moment we'll be publishing it on the IAPT web pages directly, but there may well be a link out to it from the SDCS Cloud page as well, because obviously some of the content relates to SDCS Cloud. Question from Jane, will a file be rejected if a clinical contact is submitted against care personnel where no qualification is recorded in the therapist qualification table? So this is one for you, Gavin, unless you've already answered
yeah,
it.
Yeah, for me is this. So no, it definitely won't reject the file. So that there's two tables in question here. There's the IDS 202 care activity table where you identify the care personnel. It won't cause any problem with that table. If it did happen, then you can capture more details about the qualification of that care personnel in the 902 table. If you do try to submit that without qualification, then just that 902 record would be rejected, but your file would still come through, because there's no point in submitting a care personnel qualification table if you don't tell us what the qualification is. But in answer to the original question, your file won't be rejected, and the 202 care activity record won't be rejected either. It would just be that care personnel qualification. It's explained a bit more in the technical output specification that I've linked to a bit further down in the chat. Is that? Okay, thanks, Gavin. And then we've got Neela, can the 19 pilot sites be split by the system supplier? Well, yes, they can. We do have that information. It's going to be difficult for me to give you specifics on this call. What I can say is that across those 19 organisations, as I said in my presentation, 5 of them were IAPT users, 8 of them were PCMIS users, 1 was core IMS, and then the rest of them were in-house developed systems. So that gives you an idea of the split. And certainly with the likes of PCMIS, we went through several iterations with the supplier rather than working directly with the sites. So PCMIS and probably IAPT as well have done a lot of work on the reports that are generated out of the system and then are used to generate the IDB. So anybody who uses those systems will definitely receive the benefit of all those improvements that were made to the system off the back of the private beta. Amy, is there a document that summarizes all the possible rejection codes and what they mean? So I think, Gavin, I saw something where you called out the technical output specification in response to this, I think. Yeah, so that's the first part of the question. It doesn't answer the part about what a DQ report would look like out of the system. No, and I don't think we provide anything like that in the guidance document, do we, Amal? Is there anything you can say in response to what the DQ report looks like?
No, it's not in guidance document, but this is if you have access to mental health or maternity, then you can download and see the example. But if not, then Paul, is it possible we can publish sample DQ report or send them separately?
Yep. Okay. We can look at.
Sorry, go on, Paul.
Yeah, and then we could look to publish that on the same page as the guidance document, couldn't we?
Yes,
so, yeah.
we can take this offline or send them separately.
Okay, yeah, we'll take that action then. Look at that. From Prathna, is there any list of fields where? Okay, so those that are not mandatory but before but are now mandatory. So again, I suppose the high-level response is that it's in the technical output specification. But is there anything?
There is, yes.
Okay.
It goes back to when the information standard was published. So the document you want is the change specification. I'll post another link to the DCB webpage. You can see that, but that does go through the item level of before and after, so you can compare side by side. But I'll just post that at the bottom of the chat now. But the change specification on this website that I'm about to post that you want.
Yeah. Okay. And then I think there's another one for you here, Gavin, from Saskia. Do records get rejected for spoiler information, e.g. when a GP practice end date is after the period end date?
I'll double check that one. We don't usually allow future dates because we're looking at a specific reporting period, but I'll just check that specific example.
Okay.
Yeah, if the start date of the GP registration is after the end of the reporting period, then that GP record would be rejected, and then as a consequence, the patient record would go. So in the example of your September data, we wouldn't be expecting a start date in October. For example, we wouldn't want that information until you do your October submission. So that's what's possibly causing that.
Yeah. Okay. Then there's obviously the questions here around where do we find the guidance document, which Ashley has addressed. So thanks for that, Ashley. Pratha, do you have any example table to display the DQ from any of the pilot submissions? Well, no, we certainly can't do that today, and I think the problem would be sensitive and paid data in those files, because it was obviously live data coming through from the pilots. But what we can do is that sample table that we just talked about. So hopefully that will satisfy that requirement. From Nick, do all records need an NHS number? Again, I'll let you take that one.
Yeah, I can pick that one up. So technically, we do, wherever possible, expect to submit that. It is not mandatory though, but if you don't submit it, you'll get a warning. The other caveat with that is it's got to be a valid NHS number. If it fails Modus 11 checks, then it will actually reject the entire file, because we've got to actually use a valid NHS number if we get it. So no, you don't have to submit it, but if you do submit it, then you would expect it to be a valid one, but you may get warnings if you don't submit it additionally. So the message is try and submit it and make sure they're valid. Yeah.
Okay, thanks, Gavin. And there's a few comments here about that authorization on SCDS Cloud. So thanks for those of you that have submitted those comments. And we've got Laura from Southwest Yorkshire. Hi, Laura. The main issue we had with the beta submission was out of areas which don't have a CCG code, as we don't have every out of area GP surgery on our system. Is it recommended to change this so we include the out of area CCG codes? Yeah, this rings a bell actually from the private beta. So Gavin or Amal, do you know what the latest is on all of this?
There's a few places where we capture the CCG code, so I might be answering about the wrong area. We do try and capture it in the GP table, but it's not a mandatory field. So if you don't have that information in your system and it's a required field, then we don't expect you to try and get that. I'll just see if there's some. You do need to submit it in the referral table though. It's mandatory there. So I don't know if that caused an issue there. You'll have to submit a code in there for the organisation identified for the code of commissioner. It usually would expect that it's going to be the commissioner that, so it's your own commissioner most of the time would expect, but I think the example they're giving here, what was it that, yeah, so it looks like it was around the GP table. Yeah, if it's in the case of the GP table and you genuinely don't have that, we can do local mapping as far as a derivation to actually figure out what the CCG responsible for that one is. So you can leave that one blank in the GP table. We'd expect that in the referral table, because you're the ones submitting this referral, that you would know it's probably your CCG that's responsible for that referral. So hopefully that answers that question, but if not, do follow up.
Yep. Okay. Thanks, Gavin. Question from Samuel. I got migrated to SDCS from BSP, but only have access to just one team's data. They are asking me to complete a separate DUG form for each of the services before I can gain access to the rest. This can't be right. I'm not sure I totally understand the question. I think it probably is correct, actually, if I'm reading it correctly. The fact of the matter is that you need to have approval from your CSIRO to say that you're permitted to have access to a particular data set. So yeah, it is right that you need to submit separate forms for mental health, maternity, community, and IAPT. So if that's what you're asking, then yeah, that's absolutely right. We need to have that clarity around each data set. I'm assuming that's what they mean. I think we've got Tanya on the call, so Tanya, please jump in if there's anything else you wanted to add around that. But
no, that was absolutely spot on, Paul. So yeah, we need to have it for organization and for each data set.
Yeah, thanks, Tanya. Unless I've misunderstood the question, in which case, please send something else into the chat. Some guidance coming in from Paul. Thanks for that. John, the issue I found with the two-factor authentication was that because there can be different times on the mobile and computer more than 30 seconds apart, it can fail. So it's better to use the desktop app for the authenticator instead of the mobile. Okay, that's interesting, and thanks for that. That might be useful for other people if they're experiencing the same problems with the mobile. Jane, can we submit blank GP start and end dates for GP practice codes submitted in the GP practice table?
I can pick that one up. Technically can do. Just one thing to bear in mind, we need to know what your GP is to decide which CCG it belongs to. So if you don't submit any start and end dates, you're only going to be able to submit one GP practice, because otherwise we wouldn't know which is the relevant one. So if you try and submit more than 2 records with no start and end dates, then we'd reject both of those, and then as a consequence reject the patient table. So you can do, we would definitely prefer to see those start and end dates there, but if you genuinely don't capture those in your system, then there is a way around that, but it must only be 1 record, because we will assume that is the active GP practice of that patient then.
Okay, thanks, Gavin. I'm not sure the name, but an email in from Mind in Bexley. I have some concerns regarding the time that submissions are likely to take. We don't have a full-time data lead or an IT team. Do you have any idea how long this process will last based on an average amount of rejections? I could see that some services had to make 20 plus submissions. Would be good to know how much time to free up in the diary. Yeah, I mean, it's a good question, really. I guess what we're trying to do is mitigate against all of that. The fact that we ran the private beta and we went through all of that work with those pilot organizations has enabled us to home in on exactly what the problems were. As I said, if you're a PCMIS or an IAPT user, it's likely that you'll benefit from the problems that they found and fixed in their systems. So you're starting from a better position than the pilot sites. And then, as I say, we've run this webinar, we've developed the guidance document. We are giving an extended window period for the August submission. And as we talked about earlier as well, we're trying to get the test submissions up and running before the 1st of September if we can. So we think by putting all that package together, we think it's going to help organisations out, and you won't need to go through quite as many iterations as the pilot sites. In terms of timing, it's quite difficult to put a figure on it. It obviously depends on how many people are submitting data at the same time, but typically we were able to turn it around quickly. In terms of the submission itself, I can't answer for how long it took the providers to build the data in the first place. Maybe if somebody wanted to post that information into the chat, feel free to do so. But in terms of the submission itself, we were experiencing pretty good turnaround rates. So people typically were receiving the DQ reports in a matter of minutes following the submission. Certainly, we did some tests halfway through the private beta where every single test they were definitely receiving the DQ reports within 15 minutes, for instance. So yeah, the submission process itself is fairly straightforward. Doesn't seem to have much of a time impact, but it will depend on the number of DQ issues. So I think any work you can do up front to interpret the DQ guidance and absorb what Amal's gone through today, I think that would definitely help. Okay, and now I've lost my place in the. I'll say, Kath, you mentioned using the two-factor authentication on work mobile phones or alternatively desktop version of the app. Is it okay to use your own mobile phones for this?
Yeah, I actually don't think there's a very good chance.
Sorry, can I just ask that people go on mute, please? Yes, I think Amal's responded and said, yeah, you can use personal mobile phones. Nick, just to clarify, I submit for RBN and RBNCG. Do I need separate SDCS Cloud registrations? No.
Yes. Because they're two separate.
It's a good job. It's a good job you're on the call, Tanya.
Because it's two separate organizations, they would have the same CSIRO, but to register for both of them, you'd need two separate registration duck forms.
Thanks, Tanya, for that. Got me out of a hole there. So, Alison to Samantha. The first MHSDS submission I did on SCDS Cloud took 5 submissions to achieve 0 rejections. Each one took maybe 2 to 3 hours. Okay, so that's useful insight there in terms of the local impact, in terms of building the submissions. Hopefully that helps to give you some insight. Thanks for that, Alison. And from Emma as well, who was also involved in the pilot, we use IAPT, and it took me quite some time to extract all the individual tables to import into the IDB. The actual submission to the portal is quite quick. Getting a successful submission is another kettle of fish, though. So yeah, I mean, we worked a lot with Emma and other people in the pilot to work through all the DQ issues. And as I say, that's why we've tried to provide as much guidance and assistance as we can. So I think you just need to be mindful of the fact that it is going to take some time to do this iterative work, and that's why we're keen to get people submitting as early as possible in that submission window, to give themselves as much time as possible to get through that work. Yeah, pre-submission work takes us around 1.5 to 2 days to do, so yeah. Okay, I think that's got us to the end of the chat. So hopefully we've addressed everything. Yeah, a few more comments coming through about the length of time it's going to take, yeah. Pratna, is there going to be any direct helpline or team specifically for the first few submissions to guide us to understand where it's getting rejected until we are familiar with DQ reports? Yeah, I mean, we're still working through exactly what level of support we're going to provide. We're working with NHS England in this regard, but certainly there'll be our standard service management approach to registering issues, and specifically DQ issues, and there will be some level of support, and I think also if any of you have had any experience of our data liaison service as well, we're thinking of drafting that team in. So we would maybe working in a more proactive way with you as well. Just looking out for sites that perhaps haven't submitted or are having issues with submission, and then working with those sites directly through the data liaison team. So we're looking at options around that, and we'll send further communications out. But there will definitely be more support available during those first few weeks. Is there any additional funding available? And the answer to that, as you'd expect, is no. For this extra workload, I mean, it depends on how much of an extra workload it is, I suppose. I guess the hope would be that with all these mitigations around DQ, that the extra workload won't be that much significantly more than what you suffer with BSP. So Julie Whittaker there confirming the data liaison team that I was just referring to. Yeah, so Alison is an interesting point here. The main hold-up with progressing the MHSDS submissions in the first month was the time taken to get a response from National Service Desk. I think that's right. I think we've probably moved on quite a lot since that time, though. So obviously the platform itself was brand new as well for mental health. And we've obviously had a stable platform for about 12 months now. And we were also suffering a lot with the registrations, which is why we put a lot of effort into the registrations for IAPT, and a lot of those calls actually were to do with password resets, and that's new functionality that's been introduced to SCDS Cloud. So it's now possible to reset your own password, and you're no longer dependent on National Service Desk to do that. So I think there are a few things in place that mean we should be in a better place when we go live with IAPT relative to that mental health go live. Okay, again, I think I've got to the end, but I'm going to keep this open for a few minutes anyway. So if anybody does have questions, please keep posting them in. Lisa, could I just ask you to post the standard data processing email address? Because what I was going to say, obviously, like I say, keep posting questions through to the chat facility. But if you do think of anything else after the webinar, or you just want to take it offline for whatever reason, please fire emails into our data processing email address that Lisa's going to post in a short while, and we'll pick those up offline. And there it is. So Pratha's asking a question. Is that the link that you provided, Gavin?
Yeah, I'll provide the direct link to the document. It is in there, but it might not be.
Okay. As I say, I'm going to keep this webinar open for a little while, but I'm conscious people are starting to leave, so I'll just offer my thanks. Thanks very much for everybody who's joined. Appreciate you taking time out for this webinar today.
So I've just posted the direct link to the change specification there. I think it was,
thanks, Kevin.
There is a question saying, asking when will the recording of the webinar from today be available?
Okay, sorry, yeah, my machine seems to be on a go slow all of a sudden. Yeah, so we, as I said before, we need to do some work on making the webinar, making the recording, making sure it meets accessibility rules. So we need to do a little bit of work on that and producing a formal transcript for it. And we think that'll probably take the rest of this week. So we're going to get it published towards the end of this week, maybe early next week. Okay, it does look like the questions are drying up a little bit now, so I think I'm going to draw this to a close. But as I say, if anybody does think of anything else they want to ask, please fire the questions through to that email address that Lisa posted earlier. Okay, thanks very much, everybody, and we'll close it there. Thank you. Bye.